Chapter 2: Healthcare Spending Issues Based on Health Economics and Policy, 8th edition, by James W. Henderson, published by Cengage Learning. Welcome to Mastering MHA MBA. Today we're covering Chapter 2 of our series, Healthcare Spending Issues. Every developed nation is struggling with rising costs, but the United States is far ahead of everyone else, spending over $4 trillion annually. In this first part, we'll break down the global spending challenge and look at the hard data behind the 18% of GDP that healthcare now consumes in the US. This video comes from Chapter 2 of Health Economics and Policy, 8th edition, written by James W. Henderson and published by Cengage Learning. If you're studying for your MHA or MBA, I highly recommend picking up a copy. Let's get into the numbers. The global spending challenge. Here is a fact that surprises many people. Rising healthcare spending is not just an American problem. From 1990 to 2018, every developed nation saw their health spending climb as a share of GDP. The average increase was 53%. Canada had the lowest increase at 28%. The United Kingdom had the highest at 92%. 7 of 10 countries saw increases between 40 and 55%. US spending in context. The US spent over $4 trillion on healthcare in 2020. That represents 18% of our entire economic output. Per person, we spent over $12,000. To put that in perspective, the US healthcare industry alone is larger than the entire French economy. One person's spending is another person's income. So not everyone views high spending the same way. Chapter Roadmap. Here is our roadmap for this chapter. We will first examine how healthcare spending is measured and where the money goes. Then we explore why Americans spend more than other countries. We will address the spending problem, factors associated with growth, and end with Baumol's model explaining why healthcare costs seem to never stop rising. Section 2: Spending Basics. Why affordability matters. No matter where a healthcare discussion begins, it soon turns to affordability. Employees complain about high premiums. Patients note high treatment costs. Policymakers lament rising spending. In 2019, the average family insurance policy cost over $20,000. That is up more than 50% since the Affordable Care Act passed in 2010. The average hospital stay costs over $10,000. The real concern. The major concern over healthcare spending is not that it is high. The concern is that the steady upward spiral does not seem to end. Government projections estimate spending will top $6.2 trillion by 2028, approaching 20% of GDP. Economic theory has not determined what the optimal percentage should be, but the US spends more by virtually every measure than any other country. Ways to measure spending. We measure healthcare spending in several ways. Total spending gives us the big picture. Personal spending focuses on individual care. We can report numbers in nominal terms, which are current dollars, or in real terms, which adjust for inflation. Per capita adjusts for population size, and percentage of GDP shows how much of our economic output goes to healthcare. Each tells a slightly different story. Growth rate comparison. This table shows how growth has changed over 4 decades. The 1980s saw the highest growth across all measures. Nominal spending grew nearly 10% per year. By the 2010s, that dropped to under 4%. In real terms, per capita spending grew less than 2% annually in the most recent decade. This slowdown is significant, though spending still outpaces the overall economy. Spending to GDP ratio. The spending to GDP ratio is the most widely used performance measure for healthcare. But remember, it has 2 parts. Health spending in the numerator and GDP in the denominator. Some increase is natural as priorities shift and productivity advances elsewhere in the economy. Some is due to demographics. As the population ages, we shift from acute to chronic care. The elderly spend up to 5 times more on healthcare than the young. Section 3: Spending Growth. The slowdown in growth. Our concerns over spending often ignore an important fact. Growth has slowed considerably over several decades. From 2001 to 2007, spending grew at 7.5% per year. From 2008 to 2013, that dropped to 3.8%. Annual growth peaked in 2002 at just under 10% and fell steadily until 2014 when the ACA was fully implemented. Since then, growth has been around 5.8% annually. Factors behind the slowdown. Several factors contributed to the slowdown. Prospective payment was introduced in 1983, which temporarily slowed hospital price inflation. After 15 years of growth rates above 10%, a backlash led to managed care. New technology introduction slowed. Patients faced higher deductibles and copays. And because Medicare and Medicaid represent over 40% of spending, federal payment reductions influenced private insurers to make similar adjustments. The ACA debate. Any discussion of the ACA's role in slowing spending growth ignores that the slowdown started 3 decades earlier. Advocates point to structural delivery system changes the law initiated. Critics focus on the Great Recession as the main reason. As with most disagreements, each side has a point. The trend predates both explanations, though both contributed. Growth trend visual. This chart shows spending growth from 1975 to 2019 in both nominal and real terms. You can see the peaks in the early 1980s, when growth exceeded 15% in nominal terms. The general trend since then has been downward, though with periods of acceleration. Real growth, which adjusts for inflation, follows a similar pattern but at lower levels throughout. We've seen the data. Healthcare spending is rising everywhere, and the US is leading that charge by a significant margin. But knowing how much we spend is only half the story. The real question is, what's actually driving these costs? Is it technology, our aging population, the complexity of our system? In part 2, we're going to examine the primary drivers of healthcare inflation. I'll see you there.